Okay,
Morning, Jack. How are you? Yes, all good. Can you hear
good.
me? All good?
I can hear you fine. You hear me?
Beautiful. Yes, yes, that's okay. Now it's very early, yeah? Today is
Very
first
early.
early. Thank you for all of these, yeah, like you have helped us a lot and you changed a lot of your schedule to accommodate us. Thank you so much. On behalf of Birth Kuwait family, I thank you for this opportunity.
Well, thank you for giving me the opportunity.
It's our pleasure. Today's topic is very, very nice. And it was really fascinating to see different diagnoses being given for different cases, but sometimes having one answer. And we're going to learn a lot today.
Okay, I hope so.
Yeah.
So let
So
us talk
today's
about
topic,
late onset decreased milk supply or decreasing milk supply. Uh, this comes about because for a long time, groups like La Leche League talked about nursing strikes. And I was always uncomfortable about this diagnosis. Why should a baby who seems to have been doing well for such a long time, breastfeeding exclusively, suddenly out of the blue start to have breast refusal?
yes.
And I was never comfortable with this. And I was always thinking about it. And I finally, I think, came up with what I think is the real problem, and that is that the mother's milk supply has been decreasing. So why would a
Yeah,
mother
what
who
is
starts
happening?
off with a lot of milk, why should her milk supply decrease? And I should point out that decreasing milk supply does not mean necessarily not enough milk, because a lot of these mothers started off with an abundant milk supply. So the decreased milk supply does not mean not necessarily enough. And so frequently the mothers don't believe me when I say you've had a decrease in your milk supply. No, they say I can squeeze milk and I hit the wall and the baby is gaining weight. Well, but that's not the whole story, because these babies are frequently unhappy, they are fussy, they fuss off the breast, they fuss on the breast. They often spend lots of time sucking their fingers or using a pacifier. And so something is wrong here. And so we finally realized when we saw these mothers at the clinic what was going on. Because the best way to know if a baby is doing well at the breast is to watch the baby at the breast. And these babies were drinking often for very short periods of time. They were drinking well, but they were often drinking for only very short periods of time. And then they would come off the breast and they would suck their hand or suck their fingers, and they would be fussy if they weren't sucking their fingers. And that's how we began to understand what was going on.
I want to ask you about, you mentioned something about they nurse for a short time. What is the, like, if we can get a bit of numbers, what are we talking about here that we can consider that is short?
I don't like to talk about numbers in
I
breastfeeding. I think that a baby should stay at the breast and drink as long as he's drinking. And when he starts to slow down and doesn't drink well, then the mother should offer the other side. And that's one of the problems that we see that causes this late onset decreased milk supply, is that mothers have been told, just feed the baby on one side so that the baby gets the high fat milk. Well, here's the answer to that, is that if the baby's not actually drinking at the breast, and people who are listening, if they want to go to our website, we show videos of babies drinking or not drinking. A baby is not drinking simply because the baby is sucking at the breast. A baby has to be doing that sort of pause, pause type of suck in order to be drinking. So one of the main causes of this late onset decreased milk supply is mothers are being told that the baby has to stay on just one breast so that the baby gets the high fat milk. And what that means is that we're not understanding that a baby is not getting milk just because he's on the breast and sucking at the breast. And so if the baby is not getting milk, he's not getting high fat milk. So how long should the baby be on the breast? Well, as long as he's drinking and seems happy at the breast, he should be on that side. And then when the baby starts to slow down or not to suck at all or not to drink at all, then offer the other side. Now, the baby may be satisfied after one breast, but that's not the same as you've got to keep the baby on just one breast. So I will not answer your question. How long how long should the baby be on the breast?
My question was, what is short? What is too short? Like if we say, okay, if the baby is staying on the breast for a short time and then suckling the fingers, then the mom will be asking, what is considered short?
Well, that's short, whatever that is. Okay, you want a number, you want a number. Often the mothers will say that the baby is on the breast for only 2 or 3 minutes before he comes off or just sits there and sucks without drinking. So that's the important issue, is not how long the baby is on the breast, but how long the baby is drinking. But we don't have a number for that either, so I'm not going to answer.
All right, I'll take that. I will settle with that. So we're talking about the baby who starts with good weight gain, right? And milk supply is good. And then after a while, there are symptoms. Baby fussing on the breast. Can I also say biting? Because most of the time when a baby is biting, then moms are always considering teething. And then when I introduce the fact that milk supply is not in terms of baby's weight, but maybe flow, then they would first refuse the idea, but come after a couple of days say, you know what, yeah, I noticed something different, and that also might lead to that. So there is biting, there is fussing. You also would introduce us to more symptoms that would be something else, considered something else, but maybe related to the late onset decreased milk supply.
Yes, I've already mentioned fussing on the breast, fussing off the breast, the baby refusing the breast. But
Yes,
what is
so nursing
interesting,
strikes, early weaning.
not necessarily early weaning, not if the mother gets help quickly, but often, unfortunately, the mother's response to the baby or the pediatrician's response is, well, just give the baby a bottle of formula or breast milk. And that makes it better? No, it actually makes it worse. So what's interesting about this situation is that at first, even if the baby refuses the breast during the day, they actually breastfeed very nicely at night. And so one of the causes of this late onset decreased milk supply is not only what I'll mention in a few seconds, is the fact that mothers are trying to night wean the baby. And babies should not be forced to stop breastfeeding at night. Breastfeeding at night is good for the baby, good for the mother, and good for the breastfeeding. So we see this late onset decreased milk supply for several reasons. One is that the mother has been told and follows the advice of give just one breast at each feeding. Even worse is do what's called in North America block feeding. That is, your baby is getting too much milk, the baby can't handle the flow, then just give him 2 or 3 times the same breast before offering the other side. And what that means is that the milk supply will definitely decrease. And what that means is if the baby can't handle the flow, if the baby chokes and coughs and sputters at the breast, that means not that there's too much milk, but that the baby has a bad latch. And if the baby has a bad latch, he can't handle the flow. So the problem is not, I have too much milk. The problem is the latch is not the way it should be. And so this idea of feeding the baby on the same side 3 feedings in a row or 4 feedings in a row is really a very bad idea. And so we try to discourage that. What else might cause this late onset decreased milk supply? The birth control pill. The doctors, the pediatricians, the obstetricians always say, oh, the birth control pill doesn't affect breastfeeding. Yes, it does. There's no question about it that a lot of mothers will see a decline in their milk supply as soon as they go on the birth control pill within about a week or 10 days. The other thing is the baby has a tongue tie. If a baby has a tongue tie, the baby can't latch on well. If the baby can't latch on well, then he doesn't get milk well either. So there's both the baby chokes at the breast or coughs at the breast, and everybody worries about that. But actually, it's not that terrible, because breast milk helps to protect the baby against infection, and it protects the baby infection by filling the intestinal tract and the respiratory tract, not filling it, but having milk get there, and the various immune factors in the milk will protect the baby against infection. So, aspirating a few cc's of breast milk is not dangerous, even though pediatricians will start to do what are called feeding studies that show, oh, the baby aspirates, the baby aspirates. You got to stop breastfeeding. And I think that that is also a very bad idea, because what they do in that test is not breastfeeding. They give a bottle of something and they say, oh, the baby aspirated some of this, you have to stop breastfeeding. I guess I'm wandering a bit here, but
Yes. So we're talking about when the mom is having all of these symptoms, and maybe when their complaint isn't very clear of decreased milk supply, we can look at these symptoms and check the effects. So are you suggesting that all babies should be checked for tongue tie, no matter what symptoms they have, the mom has pain or not?
well, of course, I think that one of the things that we do in hospital is do a physical examination of the baby. Why would people not look inside the mouth? And they don't, because we, in 1 year, a few years ago, we found 5 babies came to the clinic with breastfeeding problems that had cleft palates, a posterior cleft palate. So nobody noticed it, but we noticed it. We noticed it because a baby with a posterior cleft palate often sucks like this.
Yeah,
And
with the sound.
yeah, with that sound. And so people are obviously not looking in the baby's mouth. And yeah, I think that if the baby has a tongue tie, to prevent breastfeeding problems, the tongue tie should be released. And that can be done in hospital. There's no reason there's no reason to wait to do it until problems arise. And problems often do arise. And one of the most common problems that mothers have when the baby has a tongue tie is sore nipples. If the mother has sore nipples, then the baby's latch is not good. The baby's latch is not good, and the baby has a tongue tie, well, release it. Save the mother from all that pain.
Yes. And some of the symptoms might not make like perfect sense. Like, for example, if a baby has mucus in the diaper, you
Or
would
blood.
blame allergies, right?
They
So I
often
want
do.
to ask you, as a doctor, do allergies come later? Like if my baby has allergy from cow's milk, and I have been drinking cow's milk for the first 3 months, and then suddenly there's mucus in the stool, can babies develop that allergy later?
I don't believe that exclusively breastfed babies get allergy to something in the mother's milk, something that the mother eats or drinks. I think that if it happens, it's not common, and the most common cause of the mucus, the green bowel movements, or even the blood in the stool, that is usually due to late onset decreased milk supply. And we see that, and if you copy the link I sent you from our website. Talks about a mother whose baby had blood in the stool. The mother was put on dairy-free diet. It didn't get better. We increased the mother's milk supply with domperidone, and the blood went away. And once the blood went away, the baby also did not was not unhappy, did not have any problems when the mother went back to taking dairy products. And I think that this is the most common cause. Is it possible that there are some babies that have a reaction to the food that the mother eats? Yes, I guess it's possible, of course. But I think that before we tell the mother, you must go off all these foods or stop breastfeeding and give special formula, I think we should at least treat the mother for late onset decreased milk supply. And what we see in our clinic are usually only 2 things. The mothers show up around 3 months. The baby is fussy and all the other things we talked about. And we see either that the mother was feeding only one breast at a feeding, and sometimes that the baby has a tongue tie. So we will treat the mother with domperidone to increase her milk supply And usually things get much better. The problem is the longer we wait for treatment, the more difficult it is to fix. So as soon as the mother is seeing that the baby is not happy, that she's starting to use a pacifier in this previously happy baby who was gaining well and happy at the breast, I think we should see them very, very soon. And I think that once we teach parents and doctors how to know a baby's actually drinking milk from the breast rather than just sucking, then we will be able to come to these problems much earlier, even if the baby seems to be otherwise well, and we can go from one breast per feeding to both breasts at each feeding, and even 3 breasts, back, forth, back, and sometimes use domperidone, and sometimes use release tongue ties.
So we're talking about symptoms that moms should look for, and when they notice them, as early as possible, try to reverse whatever has been happening, the one breastfeeding or one side feeding, and releasing tongue ties. So we are recommending that moms think in a broader way about breast milk supply and consider other symptoms that were not like usual for them, right? So my question is, the treatment, you mentioned domperidone. Why didn't moms way back use these type of medicine? Like, why is it coming now that more and more moms are needing such medicine to increase milk supply?
Well, I think it all goes back to how mothers give birth. Mothers give birth now with epidurals and lots of medication, and this affects how well babies start off with breastfeeding. They don't latch on well, they cause the mother pain, the babies don't get milk well from the breast, and often the first week of life is a terrible situation for the mother and the baby. And milk supply and good breastfeeding are started in the first week of life. And so in the days before epidurals and lots of medication for labor and birth, mothers usually did well. There were exceptions, of course. It's always possible that there are some mothers that don't produce enough milk. There are situations where mothers have pain, and pain was always considered, recently was considered normal. You're supposed to have pain when you breastfeed. I don't agree. So people would just sort of fight through it. Mothers would bear with it. They would say, oh, it hurts, but it'll get better. And it does sometimes get better, but not always. And I think that we need to prevent these problems.
Or use shields.
Go ahead.
Sometimes they use shields, yeah?
Oh, that's a good way.
So
oh, that's a beautiful way to decrease the milk supply, is to use a nipple shield. And I think that that's not the treatment for sore nipples, and it's not treatment for babies who don't latch on. If the mother has enough milk so that the baby continues to gain weight well, when the mother's using a nipple shield, that baby would have taken the breast if only we had a little more patience and a little more good help.
So the technique matters. And also sometimes moms would pump and give the baby the extra milk because they have pain. So sometimes because of sore nipples, they go into pumping, and you're saying that's not a good idea either, right?
Well, the baby will eventually, in many cases, refuse the breast altogether. And I think that breastfeeding is not the same as breast milk in the bottle. Breastfeeding is much more than that. It's a relationship. And so mothers should try to maintain breastfeeding. And if they feel they have so much pain, they have to take the baby off the breast, they should get help, and get help early. You know, a lot of these babies have tongue ties if the pain is so bad. And a lot of these babies are just latched on very, very poorly, very shallowly. They suck on the nipple. And so it causes the mother pain, and this can be fixed. It's not something that has, you've got to take the baby off the breast. And I think that it's a real shame that we don't help mothers out in such a way that they they feel they must take the baby off the breast. I don't know if you were disconnected there
It's
for a
discouraging,
second.
and it's not showing them the support. I'm with you. I'm just sad.
Yeah,
It's just sad. And now, especially in this, I mean, in Kuwait, we have a good doctor who does the tongue tie clipping, and she also been in contact with you and like clarified of ways to do it, like we like to call it the breastfeeding way, because sometimes doctors would clip it and say, oh, that would do it. I released it a bit, not all the way, but that would do it. And or saying it's not significant. And that's we're still lucky that we have those, because other countries uh, near to us, neighbor countries, they don't even have someone to clip the tongue
yeah,
ties for the babies.
yeah. Well, it varies across Canada too. In some places it's done, in other places it's, oh, it doesn't mean, oh, no, that's not the problem.
Yeah. And we have talked about tongue ties before, so I will not go there. I just want to ask you about domperidone. So, do you have any tips for the moms who are concerned about side effects, or do they have to monitor for any things, or is it for specific people and not for others?
Well, domperidone is actually one of the safer drugs around. I mean, there's no such thing as a drug that doesn't cause side effects. Now, domperidone is supposed to cause a specific type of arrhythmia in very, very, very few people. Women seem to be more immune to this, but if there's any question that there's a history of the arrhythmias in the family or in the mother herself, then an electrocardiogram can be done. And if that electrocardiogram shows normal QT interval, which is the distance between the Q wave and the T wave, then there's no real issue. Although if they go to the internet, they'll find that, oh, my uncle had a murmur, then, I can't take domperidone. Or I had a murmur when I was a child, I can't take domperidone. Or my father died of atherosclerosis, I can't take domperidone. That's not true. That's just not anything. The only issue is the prolonged QT interval on the electrocardiogram. We do not do one in every mother or baby, but if there is some question about possibility of arrhythmias, then we will recommend an electrocardiogram. And again, if it's normal, then it's normal, and there's no need to worry about the domperidone.
So do they need to look for any symptoms if they consume the medicine?
Well, like every drug, if there are possible symptoms, then we should look into that. But often people take a medication, they get a cold or they get a rash, and they say, oh, it's the medicine. Well, it may not be the medicine. We get mothers complaining of heartburn sometimes with the domperidone, but domperidone is actually a treatment for heartburn. So it seems unlikely that if they get heartburn that it's due to the medicine, but who knows? We should check these things out, but we shouldn't make a big deal out of them. Very few mothers get problems with domperidone. The only thing that we see is if they are taking domperidone for many months and then they stop quickly, some mothers will get depression and insomnia and that sort of thing. So they should not stop it suddenly. They should stop it very slowly. And we have a list of how to stop domperidone slowly.
All right, that was very informative. So your recommendations to the moms is to start with a good birth plan and initiate breastfeeding really early, which is the right way. It's not early; it's the right time. And
Right.
check for tongue tie. Watch for breastfeeding for both breasts, not one, and watch for the baby's cues. Don't watch the clock, right?
And don't watch the weight so much, because these babies often gain weight okay. Not always, but often they gain weight just fine. So people say, well, it can't be the breastfeeding. Something else is going on. They'll often say, oh, it's reflux, or they'll say it's allergy to something in the mother's milk. Those are the two common excuses for the baby's behavior. But it's not that. It's the baby's responding to a decrease in flow. And you say give both breasts, and I agree. Offer both breasts. Sometimes a baby will drink enough from one breast that he doesn't want it, but offer.
Yeah. Thank you, Dr. Jack Newman. That was very informative. There are so many moms who are going to get this information, and it will help them succeed in their breastfeeding journey. Thank you
Thank you
so
very
much.
much, Nour. Until next
Have a
time.
good day.
Okay, bye-bye.